Good afternoon. My name is Kathy Lysak. I've been at Wayne State as a professor in occupational therapy and gerontology for the last 20 years. It's a delight to be in front of you and to introduce our three speakers for the day, who will each speak for about 10 minutes, and there'll be plenty of time for interaction and questions. Are you hearing me fine? Okay, I'll make sure I speak right into the mic. Our first speaker today is Dr. Teresa Hotrop. She's a native Michigander born and raised in Flint. She completed medical school at Michigan State, go Trojans, and she did her pediatric residency at the Children's Hospital right here in Detroit. She's worked as a general pediatrician in a federally qualified health center on the east side in Detroit, also in Highland Park for 4 years, returning to the faculty of the Children's Hospital Pediatric Clinic in 1991, where she stayed for 24 years. I'm still trying to justify how young she looks. Maybe if you work in a pediatric area, you stay young. I'm on the other side of that aging spectrum, so we're gonna have to trade some secrets a little bit later on. Dr. Holtrop's work has sparked her interest in all sorts of community-based health issues. Of note, she's been a big advocate of children's reading and the utility of that for developing a good, strong, healthy life in young age. She's also been a member of the Michigan chapter of the American Academy of Pediatrics, and she's its current president. So she's a doc, but she's a doc on the go, contributing to the community and her field. She is currently the executive and medical director of Wayne Children's Healthcare Access Program. And this is a program that seeks to help medical practitioners whose work bridges the gap of various resources in the community while providing direct services, including Fit Kids 360. I'm interested to hear more about that. She's also involved in asthma education in home settings and data analysis to improve pediatric care for kids and families. So please help me in welcoming Dr. Teresa Hotrop.
Okay, I came prepared to do a presentation very formally with a PowerPoint, and I'm going to do it without a PowerPoint. So what I'm going to talk about is basically some information about adverse childhood experiences, and kind of get the idea what that is all about. There's actually a huge study that came out about it. I think it's going to be of interest to everyone, and how that relates to stress. We're the Center for Urban Responses to Environmental Stress, so that seemed to fit. First of all, what types of stress are out there? There's a positive kind of a stress, a good kind of a stress that kind of pushes you to kind of grow, right? It causes you maybe to have a brief increase in your heart rate, mild elevations in stress hormone levels, but you're able to get over that. And if you don't have any kind of stress, you just don't grow. Then there's tolerable stress. Tolerable stress can be serious, but it's temporary, and our body responds to it. And I mean, let's think of, I don't know, what would you say a bear walking down the street behind you? Is that a tolerable stress? It might be tolerable for if it just is a minute and it's like, ah, okay. All right, but what happens to your body when that happens, when you see a bear behind you? Your brain sends a signal to your heart starts to beat real fast, it sends a signal to your adrenal glands, you start to release stress hormones, something called cortisol, something called adrenaline, and your pupils start to dilate, okay? That kind of a stress response, if you have it, and then it goes away, it's a tolerable stress. But this kind of a stress response, if that happens, if that bear shows up every day, and you know that bear is really dangerous for you, having that kind of a stress response is not a good thing. It's not a good thing for your body. And this is something that was, we now have really good information on what happens. When that happens in a chronic, repeated way, we call that toxic stress. Okay? All right. So in 1998, there was a big study that came out, and it was done by Dr. Felitti and Dr. Anda on the west side of the country in California, and it was called the Adverse Childhood Experiences Study. It came out of work that they had done with adults who were in an obesity program where they were finding that folks who were the most successful in losing weight were dropping out and were suffering from anxiety, depression, and suicide attempt, divorce, as they were making improvements in their weight. And on the flip side, they had folks who were cheating on their diet, but they were religious about attending the mandatory weekly therapy session. And they said, this doesn't make sense. What's going on here? And they started doing a little bit more research into this, and in the end, this resulted in a study that involved over 17,000 patients. And basically what they did was they sent out a survey. The survey that I have given you is not quite the same, but it's very similar. And in the survey, they asked about 10 different things. Now, that survey has 14 different things in it. And what they asked about were measures of, in the first 18 years of your life, did you suffer from psychological abuse, physical abuse, sexual abuse? They asked about 2 things that dealt with neglect: emotional neglect, physical neglect. And then they asked about 5 measures of household dysfunction. Was there someone in the household who suffered from substance abuse? Was there parental separation or divorce? Was there mental illness? Was there a domestic violence? Or was somebody incarcerated? And then they got these surveys back, and they got a tremendous response rate. It was like, for the researchers here, 68% response rate, which means these results are probably pretty valid. And by the way, this study was done in a white middle-class population where most of them were college educated. And what they got back was that at least 2/3 of the population had at least one of these things happen to them. And about 16% of them had 4 or more of these things happen to them. And what they did was they went into the charts and they looked in the charts to see what happened with these, what kind of health behaviors did these patients have, how much smoking, how much physical activity, number of sexual partners, history of alcohol use, history of drug use, whatever. And then they looked to see also what diseases did they have. Now, if you're smoking, your risk of having lung disease goes up, right? Makes sense. And of course, they found that, number one, as the score on their ACE questionnaire went up, the higher your ACE score, the more likely you were to have unhealthy health behaviors. And also, the more likely you were to have all these illnesses. But here's an interesting thing that they found. Even if the person did not have unhealthy health behaviors, in other words, they weren't smoking, they weren't drinking, as their ACE score went up, their risk of disease still went up. So if you had an ACE score of 4 or 5, your risk of heart disease, of stroke, of cancers, of autoimmune diseases went up. And that didn't make sense. How did that happen? They've done more and more studies on this, and this has been confirmed numerous times. And what they have found is there are 2 things that happen. Number one, what happens in the brain when you are suffering from high cortisol levels chronically? It causes pruning of the connections in the brain. And this is what increases your risk of having mental health issues. It actually increases the sensitivity of your pleasure centers, or decreases, I guess, your sensitivity of pleasure centers, so that you're seeking, it kind of explains why you would be seeking drugs or alcohol or whatever. So that's the one thing. And the other thing that they discovered was that as your cortisol levels stay high chronically, it also turns certain genes on or off. So your risk of you may be carrying the gene for heart disease, and it's not just one gene, it's multiple genes, but whatever. The chances of you having heart disease depends in part on whether that gene is actually expressing itself, okay? Your chances of some of these genes getting turned on or off, in a good way or in a bad way, the bad stuff is more likely to happen the higher your ACE score, okay? Now, I have some information here, and I think my minutes are probably almost up, right? Okay, all right, hold on here. Oops. Okay, so what happens when you have a young child who has experienced a number, lots of adverse childhood experiences? And by the way, we haven't done any formal studies in our community here around what the adverse childhood experiences are amongst our population. But I will tell you one thing. When I was still working at Children's Hospital, I just retired from there in the early 2016. I several times, multiple times, handed out that questionnaire to my parents. And it was not uncommon for me to get scores back of 7, 8, 9, and 10. We have, in the current work that I'm doing right now, we have a program that we call Fit Kids 360, that we work with children who are overweight or obese. And it's not just the children who are participating in this program, it's also the adults, the parents, or the siblings can participate. So we decided we really need to find out how best to serve our families. By the way, the Fit Kids program has been tremendously successful. It's just an 8-week program, once a week, 2 hours in the evening, once a week, and the families love it. We have an 85 to 100% retention rate, which means we're doing something right. So we started asking, as of this year, about these adverse childhood experiences, and we found that our average of ACE score for our families, for our parents, is about 3.46 or something like that. So that they have at least a score of 3, which already we know is pretty high. But we had parents who had an ACE score of 8, 9, 10, and 11, okay? So we know that in our community, adverse childhood experiences are really, really, really common. Now, I think the one thing I want to leave you with is adverse childhood experiences will definitely have an effect on your health and on your health outcome. Folks with high ACE scores can have a much lower life expectancy, et cetera. But this is not just a horrible story, oh, there's nothing you can do about it. There is something else that you can do about it, and that is there's a resiliency factor. How much resiliency how much support did you receive as you were growing up? And that's what I like about this survey that I handed out to you, because the original study did not include questions about resiliency. And I have found that as you ask about resiliency, you end up finding families who have gone through some really horrible things, but have been able to get through them because there was a lot of support available. And my question to you that I'm going to leave you with is, what can we do to build the resiliency within this community? What we have found within our Fit Kids families is that the average resiliency score is amazingly high. And we wonder, we don't know if this is true, but we wonder if the reason that it is so, that what we're seeing is that the families who are willing to participate in the Fit Kids program, it takes a little bit of a commitment, okay? Maybe the ones that are successful, they're successful because they have high resiliency. And so when we get families referred into us, maybe one of the things that we need to look at is how do we build that resiliency to make it more likely that they can be successful in getting through the Fit Kids program. So that's what I'm going to leave you with.